Music has no boundaries.
Music unites us.
Pakistan Global Community.
चलता रहे ये कारवां.
Hello everyone, my name is Usha Subramanian and I'm here on behalf of PGC Social Care Initiative, and I'd like to begin by thanking 𝐼𝐍𝐸 for spearheading such an important cause and for giving me an opportunity to say a few words. October is Breast Cancer Awareness Month, and a good number of us know someone who is undergoing breast cancer treatment or perhaps has lost a loved one to breast cancer, and some of us are undergoing treatment ourselves as we speak. Now, I'd like to deviate a little bit from breast cancer and talk about my own cancer diagnosis, a different kind, the symptoms, diagnosis, my treatment, ongoing treatment, as well as how I cope with the illness. Now, my cancer diagnosis came about almost 6 years ago when I went to the emergency room for a blood transfusion because of a low hemoglobin count. My gastroenterologist was alerted to this, and he did an endoscopy, found a swelling in the duodenum, did a biopsy, and discovered a tumor. Now, mind you, this tumor was not related or did not cause the blood loss, which was easily treated. But having discovered a tumor, he wanted to run additional tests to make sure that the tumor hadn't spread to other parts of the body. The tests did reveal that the tumor had spread to other parts of the body, and so he referred me to an oncologist right away. The oncologist told me that I had metastatic malignant neuroendocrine tumor. It's a mouthful, isn't it? It's NET, or NET for short. Now, a couple of names that I mention you'll recognize. The famous Bollywood actor Irfan Khan and Steve Jobs had neuroendocrine tumor. It's a rare type of cancer, and about 12,000 people get diagnosed with the neuroendocrine tumor every year. Now, before I talk about my own journey, I'd like to talk about NET and some of the symptoms. Now, I did some research online, and so here goes. Neuroendocrine tumors are cancers that begin in specialized cells called neuroendocrine cells. Neuroendocrine tumors are rare and can occur anywhere in the body. Most neuroendocrine tumors occur in the lungs, appendix, small intestine, rectum, and pancreas. There are many types of neuroendocrine tumors. Some grow slowly and some grow very quickly. Diagnosis and treatment of neuroendocrine tumors depend on the type of tumor, its location, whether it produces excess hormones, how aggressive it is, and whether it has spread to other parts of the body. Let's talk about some symptoms now. In general, neuroendocrine tumor signs and symptoms might include pain from a growing tumor, a growing lump you can feel under the skin, feeling unusually tired, losing weight without trying. Neuroendocrine tumors that produce excess hormones might cause skin flushing, diarrhea, frequent urination, increased thirst, dizziness, shakiness, and skin rash. Now, I had diarrhea for a few years leading up to the diagnosis, right? Up until the diagnosis, rather. I didn't pay attention to the diarrhea at first. I ignored it and I didn't worry about it. It just became part of life. After about a year and a half, my family insisted that I see a doctor about it. And so I did. Did an endoscopy, a colonoscopy. Nothing much came off of it except the doctor saw a slight swelling in the small intestine and prescribed medication, and that was that. until the diagnosis. So when I got the diagnosis, it was devastating. The doctor said that I likely had cancer for a few years before it was diagnosed. And because it went untreated for a few years, it had spread to other parts of the body. And because of that, surgery was not an option. Chemotherapy was not an option. He said the only option was to get a monthly injection of somatolin depot for the rest of my life. And the doctor, the oncologist, also advised me that my cancer was not curable but treatable, which means that I will live with cancer. As long as I live, I'll have cancer. So this was hard, but I had to get on the treatment right away, and I started the monthly injections. 2 months into it, my cancer started growing aggressively. Tumors started growing, and I had to get radiation therapy, PRRT. Luckily, it slowed the growth of the tumors, and I have been taking injections very religiously, once every 4 weeks. And I get a couple of scans a year. I get an MRI and a PET scan every 6 months to make sure that the tumors have not increased in size or spread even more. And I was given a 50% chance to make it past 5 years. I'm coming up on year 6 in Jan of 2024, so yay. I have to say that I'm lucky that it's asymptomatic in a sense, because I'm able to lead a relatively normal life. I have a full-time job, and I'm able to stay active. And I've quit sugar from my diet. Sugar is generally not good for you, and so I quit sugar cold turkey as soon as I got the diagnosis. So no sodas or desserts for me. If I'm craving dessert, then I make it with dates, and I'm good to go. I exercise when I can. As far as mental health, right? Mental health is as important as physical health, right? With such a diagnosis, it can be devastating. It can send you spiraling into depression. Something interesting happened with me. The diagnosis kind of switched something in my mind, and my perspective changed on life. There was a sense of urgency suddenly. All the things that I had postponed for years, right, I wanted to do right away, because now I knew that my clock was ticking, right? So I started to travel more. I started visiting all the friends that I hadn't seen in years. I even met with some amazing 𝐾𝐖𝙣 singers. Music, I have to say, has been therapeutic for me. It feeds my soul, and I enjoy, and I thank 𝐾𝐖𝙣 for that. I've made some lovely friends through 𝐾𝐼𝙣. I enjoy spending time with my family. Support is very important. I have a very good support system, and I'm thankful for that. Let me leave you with this, right? I'll leave you with this thought. Health is the most important thing, folks. So please focus on your health. If you feel something is wrong, please consult a healthcare professional right away. Do not self-diagnose. Please eat well, eat healthy, exercise, do all the things that you want to do. Please do not postpone. Love yourself, live life, sing, and stay happy. Thank you so much.